Welcome to Brain Wellness, the podcast. I'm your host, Mandy NP. Each episode will bring you a new topic or interview related to brain health and wellness as part of my mission to help you on the path to a healthier, happier brain. So let's get started. Hello, everyone, and welcome back to another episode of Brain Wellness, the podcast. My guest today is Susan Parso. Susan is a mom, teacher, and coach who's learned the importance of taking care of herself. She has fibromyalgia, scoliosis, and has lived with migraines for 5 years. She has discovered the connection between mind, body, and health, and is learning how to overcome and even thrive with chronic pain. Thanks for being on with me today, Susan.
Thank you for having me.
Yeah, yep. So I always like to ask people first off, kind of what's I've been doing this for 24 years in healthcare to some degree, always in neurosciences, but what is your story? Why does brain health interest you?
Well, it started with my migraines. I never really thought about it before. And then I was researching like how do I cure migraine? And doctors weren't really able to help me. I've been on all kinds of medications. And so I just started learning more and how important our brain health is to our body. And if you break an arm, like you can still function, but if your brain is not working right, you can't function.
Yeah.
And so that kind of made me like do all this learning and how important our brain is to our body and how it works together. And now I just think it's kind of fascinating.
Yeah. Yep. How long have you had migraines?
I've had them for about 5 years.
Okay. Did you have anything in your life that changed beforehand that kind of triggered the migraines, or did you have family history?
So I think about that a lot.
Yeah.
Like, how did this happen? And I went through a lot of things all at once. I had an abusive husband.
Sure.
And he was cheating, and he also hit me, and I got a concussion. And the woman that he was cheating with, this is just a crazy theory. I've never seen any research about it, but we hear about the connection between your gut and your brain. And she had terrible chronic migraines. And then all of a sudden, I'm getting terrible chronic migraines. And I was like, is this a thing? I mean, I really don't know. I haven't heard a lot about it, but
Sure.
you hear about the gut can cause depression, if your flora, fauna, and all that stuff is off. And I'm like, well, why couldn't it cause migraines if your bacterium, I don't know the scientific names, but if your stuff gets messed up, why wouldn't it cause migraine too? So that's just one of my theories. But I also had a concussion, and I was under a lot of stress because I was with an abusive husband, and I didn't sleep well. And so there's all these things that I just don't really know what caused them, but I have all these theories.
Mm-hmm. Did you know about the cheating when your migraine started?
No, it was about 2 years later, probably.
Okay. My thought with that is that if you knew about it and it was increasing your stress, then we could say stress is the answer. But if you didn't know about it, it's hard to say that connection. So I've not seen any research myself, but it would certainly be a fascinating thing to look up. So you have triggered my interest, and I'm definitely going to be looking that up as well, because you're right on that gut brain connection. So one thing that you may or may not have heard of, or my listeners may or may not have heard of as well, is when somebody has kind of intestinal illnesses, and we have to do it's almost like a transplant, or it kind of is a transplant of their gut flora. It's something that's not real positively talked about, but it's a stool transplant, and it can be done in a capsule. So they encapsulate the stool bacteria and transplant that into somebody else. They can take that as a capsule and swallow it, and they get the bacteria from that other body. If they get a transplant for example, if a patient who is very thin gets a transplant from a patient who was obese, that thin person that gets that transplant can all of a sudden start having issues with their weight. So it's definitely a good theoretical concept that potentially if he was swap and spit with the other gal and came home and was kissing on you, there theoretically could be a connection there. So like I said, it's a very fascinating thing that I will definitely be looking into more. And if I learn anything, I'll get back to you on it.
Okay, I'd love to see what you find.
Yeah. So was there any family connection? Did you have any family history of migraines or anything else like that?
My dad would get what he called like stress headaches.
Hmm.
But I remember when I was a little girl, they would knock him out and he'd lay on the couch sometimes.
Hmm.
But he never called them migraines. So I
Sure.
don't know. He never threw up from them or anything.
Sure. Sure.
So that's a connection too. I don't know.
Yeah. And then just for sake of conversation too, can you describe what happens when you do get a migraine?
Oh, yes, I can.
Yeah.
I was reading another book and the way they described it was perfectly, but I can't remember what he said. But for me, feel, sometimes I'll wake up with a headache, a
Sure.
mild headache, and then it'll get worse as the day goes on. Or sometimes I'll feel fine, and then I'll get like pressure in my eyes,
Hmm.
and that's how I know that it's coming. So if
Okay.
I'm at work and I start to feel the pressure, I'm like, okay, how long can I last before I can't
Hmm.
drive? I'm like, do you think I can stay till lunchtime? Do I need to
Hmm.
go now? And then the pressure will kind of build and it'll feel like my eyes are going to burst. And then my vision goes kind of wonky. And then once that happens, I know it's like soon. And then the
Hmm.
nausea hits, and then the pain hits, and then I need to run to the bathroom. And then
Yep.
I lay in bed and try not to cry because crying makes it worse.
Yep. Yep.
And that's how they happen. And
Yeah.
it could take a few minutes or it could take a few hours, but I can
Okay.
kind of know from the pre symptoms what's going
Yep.
to happen or how much
Yeah.
time I have.
Yeah. Yep. And how often are they happening for you?
Um, I'm controlling them pretty well now, but
Sure.
at first it was maybe like one or two a month, and then they just got more and more until I had about like eight, I would say, a
Mm.
month.
Okay.
And now I am on a medication that's helping me, and I
Sure.
haven't had one in a month, but I've
Nice.
done 4 years of stuff to get to this point.
Yeah. Yep. That's a lot of work. And part of what I do is deal with patients with migraines. And I've been treating patients as a migraine provider for almost 11 years now. And there's so many different things that can come into play. So, one of the things we always do is I ask my patients to keep a headache diary. So, we look at their food, their sleep, their stress level. I've been adding more things into it as I go, but those are kind of the big three things that I've always looked at. And we try to keep track of where those headaches happen. So that helps us try to figure out, is there a food trigger? Is sleep a trigger? Is stress a trigger? Because those are three of those main components there of triggering migraines. And once you find those triggers, then you can absolutely start working on removing those triggers from your life and trying to control them and get better control of it. Medications definitely have a role to play, but there are lots of things we can do, even lifestyle management, before we get to that point. Uh, were there any lifestyle changes you made? Any diet changes? Anything else like that?
Yes, I divorced my husband because,
Yeah.
lower stress. So I
Yep.
finally got him out of my life. I mean, not completely,
Yeah.
still working on that part,
Yeah.
but so I lowered stress. Sleep, definitely. I don't sleep well.
Sure.
And I know that that is a huge trigger.
Hmm.
If I eat like fast food,
Hmm.
I'll always get a migraine. I get one around that time of the month. I'll always get one. And I read a book about this woman that had vestibular migraines, and it's like this. She said it's called like You Can Heal Your Headaches.
Hmm.
So I read that. I'm like, oh gosh, I have to cut out every single food in the world that I love, but I'll try it. And so I tried it, and then I heard about this other, it's like a weight loss program, but it's also anti-inflammatory. So
Sure.
I'm like, well, I'll try that too. So then I was trying to
Yeah.
do both, and I couldn't, because then I couldn't eat anything essentially. So I
Yeah.
cut out I did no sugar, no flour, and that helped a lot. So sleeping better, divorcing my husband, and I cut out sugar and flour, like no fast food.
Mhm.
And that helped. I went from like eight a month to like three-ish, 3 or 4 a month. And I mean, even that was a huge improvement, but
Yeah.
not good enough. But
Yeah. Yep.
but better.
So when we come to those dietary changes, especially, it's tough because when you have different foods that can trigger it, fast food is very common because they use a lot of different oils and are recommended for health anyway. But it's sometimes those triggers can be there, and sometimes depending on other life factors, they won't be as much of a trigger. And I've had migraines myself for probably about 30 years as well.
Wow.
So mine was genetic, unfortunately. My mom got them. I remember she would get them every time we would go to a Chinese restaurant because they always had MSG in the foods. And that was one big trigger for her. We'd go eat Chinese food, and on the way home, we'd have to stop and she'd be throwing up on the side of the road. I remember that like it was yesterday. And then I started having them in my early teens. My oldest son, who's now 25, started having them in his early teens as well. So that genetics is there. And even if you're doing all the right things, you still will potentially have some headaches that just don't go away no matter what you do. So the fact that your father had those headaches, there are some people that don't necessarily call them migraines. I've had lots of patients that I say, well, do you have a history of migraines? Oh, no. Do you have headaches? Oh, yeah, I get these tension headaches all the time. And then they describe them and it sounds like the migraine. But that said, not everybody's migraine looks the same. And you mentioned the vestibular migraines, and that's one that I see actually a lot in the hospital because people don't recognize that those are migraines. They might get dizzy, lightheaded, have visual difficulties, or they might actually look like they're having a stroke. There's another type of migraine. Yeah, there's another type of migraine called a hemiplegic migraine. It's a fancy term for meaning the patient goes limp on one side of their body. And again, they look like they're having a stroke when that happens. So there's so many things that can look like a stroke and so many things that can be an actual headache that's causing it in addition or instead of that. So when we talk about migraines, it's a big, wide thing that we need to kind of cast out there because everybody's are going to look different, if that kind of makes sense. So some people don't realize that they're having migraines. So I think what your dad was experiencing before probably was, he just didn't use the terminology for it.
Yeah, and he would talk about MSG and Chinese food all the time. Yeah.
Yep. So family history is huge. And we can see, like I was mentioning, lots of different kinds of types of migraines. Food was huge. Sleep. Let's talk about sleep for a minute. You mentioned that you're not sleeping well. Did that start with the stress or was that there prior to?
It started with the stress. Well, I also had a baby. He's 7 now. So
sure.
I didn't sleep well when he was little, but then now that he sleeps all night, I still don't sleep well. So I know it's stress.
Yeah.
And maybe hormonal. I don't know. I'm 46, so maybe the change is coming on too. I don't know, but I don't sleep well and it's terrible.
Yeah. So you may or may not like this little warning then. As women go through hormonal changes with menopause and things too, those migraines tend to change.
No.
So, I know, right?
Maybe they'll go away.
That is a possibility. So of all my patients that I've taken care of, some patients actually do have their headaches go away. Those migraines might go away completely. Or it might be somebody that had just occasional migraines before, and now they're getting them much more frequently. They can also change. So somebody who's had your typical migraine that has the sensitivity to light, sound, smell, has to sit in a dark room, you get the nausea, the vomiting, all of a sudden turns into one of those other types that I was mentioning where it looks like a stroke because you get the one-sided weakness or sensory changes on the one side or such severe dizziness that you can't stand up straight.
Oh, can I interject?
Yes, please.
I just thought of this. My grandma had terrible dizzy spells after she went through the shake. It started around, she was probably in her 60s, and then they just got worse as she got older. And she couldn't even stand up, and they kept telling her, it's, you're in her ear. But when I look back and see what she went through, I wonder too, was she having vestibular migraines? Because I mean, that's my dad's mom, so it would kind of make sense.
It would make sense. It would. And it very well could have been. So there might be that family history there that you're going to be battling that a little bit as well. So there are so many different factors, so many different things that we look at. I'm glad you were able to make some changes. I'm hoping that you have a neurologist that you get to work with.
Yes, I do. And that's how he gave me, can we talk about medications?
Yeah,
first?
Sure. Yep.
They gave me so many medications that all made me sick. The first one made me go like really crazy. Like I couldn't function and my brain was like, and I would hear noises and my body would like hum and vibrate. and they said, oh, it should go away in a couple days, but it didn't.
Sure.
And I thought maybe I need to call 911. Maybe I'm dying. And it was the medication.
Mm-hmm.
And then they put me on another medication that said it could cause bleeding. And it did. My eyeball like burst and I
Oh,
got
goodness.
blood pooling in my toenail. And I was like, oh my God. And so I like tried so many different medications, and that's what led me to do like, well, there has to be something causing them. It can't just be like there's
Yeah.
something wrong with me. And the doctor kept saying, oh, it's in family history, they just happen. I'm like, no. And that's when I started making all the dietary changes and trying to sleep
Yeah.
better and reducing stress and divorce I mean, everything to try to get rid of these migraines. And
Yeah.
now he just gave me a injection,
Sure.
like a monthly injection, and that's actually helped me quite a bit.
That's one. Okay. I know that's the newest one that has come out since I don't work outpatient clinic anymore. And that one came out since I stepped away from that outpatient clinic. So I haven't seen it because we don't use it in the hospital, but I've heard some
Okay.
amazing things about it. So it's definitely one worth looking into.
And when I would go to the hospital for my
Mhm.
migraine, like the urgent care, they would try to give me like a shot in the butt. I don't know, a painkiller or something. And I'm like, this doesn't work.
Sure.
Like, you cannot get, no, I don't want a shot in the butt. It doesn't work. And they
Yeah.
try over and over. I'm like, no, it doesn't work.
Yeah.
And finally, an ER doctor put me in an IV, and I don't know what was in the IV, a mixture of all kinds of things.
Mhm.
And that helps. So then every time I went to the hospital, they would put me in the infusion center and hook me up to an IV. And
Yeah.
it did some weird things to me too, but it made the pain go away. So it was like,
Yeah, there are lots that when we talk about medications, there are lots of different medications that we can use for migraines. One of the topics is for acute treatment. When somebody has a migraine, they end up in the emergency room or urgent care. There's a lot of IV treatment that we can do. The injection, I haven't really seen it work very well. Toradol or ketorolac tends to be the one that we do with the injection. I haven't seen good things with that one. I just don't see a lot of patients that get benefit from it. The IV mixtures, everybody has a little bit of differences in their site depending on which medications, but it's usually some combination of something like a Benadryl.
yeah,
So, yep, diphenhydramine is the generic for that one. So Benadryl is a common one in there. Sometimes it also includes magnesium. That's one of my favorites to include in it, especially for women because we tend to be low on magnesium.
I take magnesium every day, and I learned that from my
Yeah.
migraine
Yep.
studies. Yeah.
Yep. And then oftentimes also in there is a seizure medicine that we call Depakote or Depakon. So,
Yeah,
yep.
I've had that. Yep.
Yep. So that little cocktail, as we call it, is sometimes very, very helpful for patients. And I've received it myself in emergency care for having to stop those migraines acutely as they happen. But we don't want to do that very often. So we only try to do that as we absolutely need to. When I'm also dealing with my patients, then we try to think about how frequently you're having the headaches. And if you're having 8 or more headache days a month, that's absolutely a really good time to look at some type of preventive medication. Really, if you're having more than a few a month, then we look at preventive medication, something you can take every day to prevent them. There are 3 typical classes of medications that we start to look at on the provider side of it. One is antidepressants. There are many different antidepressant medications that we can use. There are anti-seizure medicines that actually work for migraines. And then some of the cardiac medications, like blood pressure medications, can also do the same kind of thing and prevent some of those migraines. So it's always taking it on an individual basis. So if I were your provider, we'd be sitting down and talking about what else is going on in your life to look at which one of these 3 might be a good idea for you. And then has your provider ever talked to you about Botox treatment?
I've had both. I get Botox too.
Okay. So
Yep.
once you've tried multiple medications from these different classes and they haven't worked for you, and you've tried the abortive medications as the third one, the medications like the triptan medications, those are typically what we use to try to stop those migraines. Once you've done all those things and you're still having multiple, like 8, 9, I think one of the things I saw was 12 headache days a month or 10 headache days a month. Then we look at Botox to try to cut them down. And I've seen really good results with those. Did you see results when you started the Botox injections?
It's also when I changed my diet.
Sure.
So it's hard to say if it was the diet but I still get the Botox.
Yeah. Yep.
I don't know. I think it all helps a little bit.
Yep. Everything has a different role to play. Several years ago, I was actually diagnosed with autoimmune issues after my own divorce and triggered a lot of stress in my life. And my autoimmune illness kind of kicked up in full force at that point. And during that time, I was introduced to a functional medicine provider. In some of my other episodes, we talk about functional medicine a lot. So basically what functional medicine is, we look at the root cause of health issues and we try to figure out why somebody's having the problem, rather than just giving you all these medications all the time. Why is it there to begin with? So we can treat that root cause. And maybe you don't need all of these other medications that we just talked about. So when I did that, I learned about all sorts of different lifestyle things. And that's where I talk to people more now about the diet, the exercise, the sleep, the hydration, drinking plenty of water, and some of the natural supplements, the natural elements in our body, magnesium, vitamin D, things that we should normally be getting, but we often don't get enough of. So you are different time zone than me. I'm in the Midwest. We don't get a lot of sunlight. So everybody in the Midwest is low in vitamin D.
Me too. I'm in Spokane, Washington, and it's dreary a lot.
Yeah, you guys, it's pretty cloudy out there. So we just don't get enough vitamin D, and we need that. The sun is our only natural source of it. So if we're not getting enough vitamin D, there are supplements that we can use to try to boost that in our own bodies. And there are multiple different ways. When I was initially taught in primary care, it was a different form than what I know now as being beneficial. It was always D2. We started it as injections once a week or a tablet once a week in a high dose. But vitamin D2 doesn't get absorbed as well as vitamin D3. So little tiny intricacies that I've learned along the way that I've used for myself and then I've used for my patients to try to help them.
Is that different than the vitamin D that they put in milk?
It's slightly different. And, I could go down a rabbit hole with this, but like 40% of adults are actually lactose intolerant. So a lot of us can't tolerate a lot of milk. So it doesn't help many of us to get that vitamin D supplement in the milk when we can't drink it and we can't break it down appropriately.
That makes sense.
So, yeah. Yep. So, like I said, I could go down lots of rabbit holes today, but they don't teach us all this stuff in medical school, nursing school either. Some of it I had to learn on my own as I was going through. And there are a lot of journal articles that don't make it into the mainstream journals, that they do the research on all these different supplements and they can tell you all the different best time of day to take it. Like when I learned about vitamin D, it was switching it to the nighttime. Well, we always think to take it in the morning because it gives us energy, right? Well, it gives us energy because it actually corrects our sleep-wake cycle, our circadian rhythm. And that's how we get more energy.
Okay, well, that's a good tip.
So there you go. I got lots of stuff. I've just blurted on a long kind of spiel about all the medications and everything. What are some of the things that you now have into your regular daily practice that you do to stay healthy and try to keep those headaches down?
I exercise almost every day. That helps. I try to sleep well and I keep the same routine even on the weekends. Mm-hmm. I might lay in bed longer, but I still wake up at 6 a.m. even if I lay in bed.
Yep.
And so to help with the sleeping, and I go to bed early. Mm-hmm. And I keep that routine. And then I take a whole slew of supplements, the magnesium, vitamin D. I take one called NMN with resveratrol. That's supposed to help mitochondrial function. Mm-hmm. And I take I don't know what fat, it's not fish oil, but it's seaweed oil. I don't know.
Sure. Yeah.
For your brain, I do that. And I try to avoid triggers like fast food, staying up too late or getting off of my schedule. Mm-hmm. I try not to eat sugar and flour. Mm-hmm. And then I take a monthly injection, which has helped a lot. And reduce stress, like don't have an abusive husband around.
Yeah. It comes in very handy when you reduce some of that. I'm hoping that you had family or friends that were around to help support you as well during all of that.
Oh, well, we could go down a rabbit hole about that. I don't. I'm a single mom on my own. My dad lives in California. I'm up here in Washington. Then I do have family here, but I no longer talk to them.
Yeah.
That's a whole nother rabbit hole.
Oh, there's another layer of stress right there that we could talk about for days, I'm sure.
And I also learned how to breathe. This is one of the first things I learned, and I still do it to stay calm and reduce stress. I learned how to breathe for the pain. Like I would breathe, and then while I was breathing, I would imagine a laser like going into my head, and then when I
Yeah.
breathed out, it would like suck the pain out. And although it doesn't make your migraines go away, although they claim it can,
Hmm.
didn't work for me, but it helped me deal with the pain better.
Yeah.
And then I learned that I can breathe just to like calm down, even
Hmm.
if I have a migraine or not. So now I do that at night. I breathe in for 4 and hold for 7 and breathe out for
Hmm.
8. And then I learned these other breathing things that you could do that help me stay calm and reduce stress. And I do that a lot. And that helps me when I have a migraine, and even if I'm afraid I might get one, or I just do it every day. I practice breathing for a few minutes just to
Yeah.
clear my head, and it helps.
Yeah. Yep. Breathing techniques can be very, very important for any kind of anxiety, stress. And then it kind of side helps those headaches as well because of you're reducing the anxiety and the stress. So great work on that. Good job. Anything that you would recommend, like a couple things that you would recommend to people that might be in similar situations, like first steps that they should do to try to either get out of those situations or seek help or
Yeah, I
whatever.
would say
Yeah.
reducing stress
Yeah.
would be, and sleeping, trying to
Hmm.
sleep well, 8 hours a night if you can, and just reducing stress. Like no matter what you have to do to get rid of stress, just do it.
Yeah.
Like
Yeah.
it's not worth it. Like having a husband that I tried to help him, like, oh, he needs anger management, or he's from Colombia, so he's in culture shock because we lived in Colombia for a few years before we came here, and so no, I just need to help him. No, he can help
Yeah.
himself. He's an adult. Like it's not okay to put up with people who cause you that much stress. Like just
Yeah.
get rid of it.
Yeah.
Those would be the two main things. And then doing things to help you reduce stress that you can't get rid of,
Yeah.
like the breathing and sleeping well
Mhm.
and taking the supplements, like all of it helps me.
Yeah. Yep. I'm glad you did find some help in that, and I'm glad you got out of that situation. Physical abuse, mental abuse, any of that is definitely not a reason to try to stay. And oftentimes, when women are in those situations, like you were, it's easy to make excuses for the other person.
Yes.
And you're the helper, you're the healer, you're the mother, you're taking care of kids, um, and you feel like you have to help that other person. And
Hmm.
taking a step back and realize that you don't, like as you said, that he's an adult, he needs to take care of himself as well. um, I know I've said this on previous episodes as well, but it's kind of like when you get on an airplane and they give you that warning, they give the whole spiel about the oxygen mask when they come down.
Hmm.
Who are you supposed to put the oxygen mask on first?
Yeah, you always put it on you first.
Yeah, put it on yourself first, because you can't help anybody else next to you. You can't help your child next to you if you are wilting away because you don't have the oxygen. So first and
Exactly.
foremost, take care of yourself, and that will help reduce so many other issues in your life.
Hmm.
Mhm.
Yes,
So
that is what I learned.
yeah, yep, yep. Um, Anything else that you wanted to talk about today? Any other thoughts? Any questions that you have for me?
Oh, just about the vitamin D, take the vitamin D3 you said, right? To take at
Yeah,
night.
yep,
Yeah, the supplements. And then like we were talking to you about the family connection.
yeah.
Is it really like some people just get migraines and there's really not a lot you can do about it? That's what the neurologist
So
says.
I hate saying that part when I see my patients and we do identify that family connection is there. There are things in our life that we can control, and there are things in life that we can't control. So we call them controllable and uncontrollable risk factors, right? So we can't control our family genetics. So if we do have a genetic predisposition to have migraines, it'll be there, but it doesn't mean that they're there and we're stuck with them. Those controllable risk factors, those things that we can change, our diet, our exercise, our sleep, our stress, our nutrients, all of those things will help to reduce it. So you might not be completely headache free, but you can have a good functioning quality of life that you can deal with them, you have them minimized, and it's not going to be something that's going to haunt you every day of your life.
Yeah. And I feel like that's where I'm at now. Like,
Yeah.
it could still happen. They still
Yeah.
happen, but it's not, I'm not missing work like I
Yeah.
was. I'm still able to take care of my son. I'm not rushing off to the emergency room.
Yeah.
So I feel like that's a big win.
Yeah. Yeah. Absolutely. There was a time in my life when I was having multiple migraines a week, and I would go to clinic and I'd take care of my patients, and I had to stop in the middle of my day and go get an IV treatment while I was at work because I refused to just stay home. But it was there all the time. And I didn't think that there was going to be a way out. It was hard because there was not a light at the end of the tunnel. And then when I learned about all the ways that I could manage it myself with all of those different lifestyle things, it made a world of difference. The first thing was making a change in my diet. That was huge. And beyond that, everything else kind of fell into place.
That's how I feel too.
Yeah. Yep. I'm not saying that I'm completely headache free because I still have my migraine days, but it's usually one of my triggers. If I don't sleep well, chances are I'm going to have a migraine. If I'm super stressed, or if I found out that I was celiac. So if I get exposed to gluten, those three things are things that will pop up no matter what. And all I can do is try to minimize them.
Well, since you say the celiac,
Yeah.
my dad, who's 75, just got diagnosed with celiac. And he's like, well, from what you tell me, he's like, you might have it too. Yeah. He's like, you should get that checked out. So I'm wondering too, I've been wondering if I have celiac also, and if that has something to do with migraines.
Yeah, it's very possible. There's also non-celiac gluten intolerance that has been more identified in recent research, that they are identifying that as a true thing. So even if you aren't celiac positive, you can still have even systemic issues related to gluten because your body just doesn't tolerate it. We have changed our flour in the last 50 years. So trying to avoid it is great, but it sneaks into different foods. So my kids and I love eating sushi, for example. I can't do the soy sauce when we go out because ingredient number 2 on soy sauce is wheat. And I would have never thought about it. I accidentally grabbed a thing of Twizzlers at work one time because somebody had them in there. I'm like, you know what? I haven't had that forever. It looks really good. And then I started not feeling well after I ate one piece of Twizzlers, and I looked at the package. Sure enough, the second ingredient was wheat. It's hidden in so many different foods that it takes a lot of work to make sure you're avoiding it. But we didn't have the same degree of issues with celiac that we did 50 years ago because of the changes we've had in the foods.
Yeah, I believe that. I was a while ago, but I heard someone talking about this is not your grandmother's flour.
Yeah.
And they talked about how it had changed and to make it grow faster and all this stuff.
Yep.
So that was really interesting too.
Yeah. Yep. The dwarf wheat plants, they grow faster so that we can produce more for our growing population. And they put a lot of things into it so that they don't have to spray pesticides onto it. But the chemicals are still there when you kind of break down the wheat. So there was a time that I joked that I wasn't gluten intolerant, I was pesticide intolerant. And then I found out that, I truly do have celiac. Fine, I give in. But so yeah, there are so many different factors. And we can absolutely take this conversation offline if you have more questions too. But yeah, that's lots of stuff that we could probably go on many more rabbit holes down.
Yeah.
But that's kind of the big highlights. But yeah, if you have anything else that you want to ask before we wrap up, otherwise I do want to be respectful of your time as well.
Yeah, no, that's it. I don't have any more questions.
Cool. Do you want to share if anybody wants to find you and ask any other questions for you? Would you like to share a connection place that they can find you?
Sure. Yeah, I'm on Instagram, Susan Parso on Instagram. That's probably the best place to find me.
Perfect. All right. Well, thank you so much for today, Susan. Pleasure having you on. And
thank you for having me.
Yeah, you bet. Have a great rest of your day.
You too.
Thanks for tuning in to this episode of Brain Wellness, the podcast. If you enjoyed this episode, I encourage you to subscribe, like, and share this with others to help me continue on with my mission to help people live healthier, happier lives. Go to www.brainwellnesssolutions.com to see what I'm up to and get links to all the social medias there. See you next time.